Let's dig deep.
Working in a coal mine, about to step down.
So I was reading this article in the National Review online. National Review, I consider that slightly right of center.
I would say it's more than slightly.
I mean, I wouldn't say it's far right. Okay, we'll put it that way, right?
Okay.
They're more establishment right.
You say tomato.
Okay.
I say tomato.
They wrote, by most vaccine skepticism, if by that we mean reluctance, is not based on conspiracy theorizing. It's based on risk-benefit calculations. You may think it's an innumerate calculation, but when you look at patterns of uptake in the United States, two factors stand out. Factors that are larger in their effect than partisanship, age and density. The older you are and the denser your community, the more likely you are to be vaccinated. And the younger you are and the more rural your community, the less likely you are to have gotten it. This reflects the real facts about the risk from COVID.
All right, so you're saying that these folks are making a risk-benefit analysis and
Right.
they're making the choice.
So the left will tell you that anybody who doesn't get the vaccine is an idiot and they're killing people, and you anti-science morons, follow the science. You guys should just do what you're told, shut the hell up, and take the shot.
Right.
Right?
So basically from the left, and it is just this elitist attitude that
Follow the experts.
that, basically you're hearing too many confusing voices
right.
to make up your own mind.
Right. I mean, why aren't you doing what we tell you to do when we tell you to do it?
And that's part of why Jen Psaki announced last week that the White House was colluding with Facebook to censor those posts that she says represent misinformation.
Now, I didn't just want to take National Review Online's data, what their statement at face value. I wanted to follow the science.
Okay, fair enough.
So I looked at the county-by-county vaccination data for the state of Kentucky. Now, it's up for most Kentuckys at the CDC's website, which is a bit disconcerting when you start realizing how much they're actually tracking you. But I chose Kentucky because it does have some higher population density areas and some very, very rural areas, right?
Fair enough.
I would have done Texas for the same reason, but Texas isn't reporting their vaccination data by county, which I also find interesting. All right, so here in Kentucky, for people over the age of 65, the highest risk, most counties have a vaccination rate higher than 70%
Oh, wow.
in the state of Kentucky.
Okay.
There are only two counties where the vaccination rate is less than 50%. That's Spencer County and Elliott County. There are only 20,000 people living in Spencer County. There are fewer than 8,000 people living in Elliott County.
Okay.
See where I'm going with this?
So-
again, remember, it's age. The older you are, the more likely you are to get the vaccine, and the more heavily populated the county you live in, the area you live in, the more likely you are to get the vaccine. Yes?
Right. 70% is a pretty significant number.
But that's for people over the age of 65, where most of the deaths have come from.
And you're making the argument that folks over
65.
they're making a cost-benefit analysis and saying, look, what have I got to lose?
And frankly, I would recommend to anybody over the age of 65, you're probably better off getting the COVID vaccine. That's my estimate. I'm not going to tell you what to do, but that if you were to ask my opinion, that would be my opinion.
Fair enough.
Okay. There are 7 counties in Kentucky that have more than 100,000 people in them. All right. 6 of them have vaccination rates for their entire population over 50%. That's from birth to over 100 years old.
Okay.
All right? There are 4 counties in Kentucky that have fewer than 5,000 people. All 4 have vaccination rates below 40%. So what National Review Online is saying bears out with the data. You live in a heavily populated area, you're more likely to get the vaccine. You're over the age of 65, you're more likely to get the vaccine. That follows the data from the disease. So how is somebody who lives in a rural area who's under the age of 50 not following the science?
No, I think you make an excellent point. And so what you're saying is someone that lives in a more population dense area like New York City,
Right.
They're making the calculated decision to say, look, I'm coming into contact with literally thousands of people,
And I don't know where they've been.
and I'm going to, even though I may not, maybe the vaccine isn't FDA approved yet.
Right. Yeah.
I'm just going to roll the dice because
I think
I'm better
the
off
risk,
this way.
I think the risk of getting COVID is higher than the risk of the vaccination complications for me if I live in a densely populated area. And the data kind of plays that out. There's an MIT study. MIT, by the way, it's a left-leaning school. You'd say that, Massachusetts Institute of Technology?
Absolutely.
All right. Well, back in March, they did a study trying to figure out why some people were resistant to wearing masks, right? The studies show it wasn't because those skeptics were anti-science. They were actually highly scientifically literate. They wrote, coronavirus skeptics often deploy counter-visualizations, so showing graphs, along the same follow the data rhetoric as public health experts. Yet the skeptics argue for radically different policies. They can use the exact same data and say we should do something different.
All right, so United States Senator from Louisiana, Bill Cassidy, said the vaccine is like a seatbelt. I mean, we're mandated to wear seatbelts in our vehicles. Some people would say, why is mandating a vaccine any differently?
Because we're not using public roads. You have to use a seatbelt if you're going to be on a public road. The vaccine, they want you to get the vaccine just to live, just to exist. That's very different.
But you're going into public places.
Not necessarily. They're trying to tell me I have to get the vaccine whether I go into a public place or not. And here's the other part of the problem with this. The CDC argues that kids under the age of 12 should wear masks. 3-year-olds should be wearing masks. That's what Anthony Fauci said last week. The infection rate for kids under 16 is next to nothing. It's microscopic, and the complications rate for kids under 16 are lower than that. So if the CDC keeps saying that 3-year-olds should wear masks, and then it says all Americans should get the vaccine, there's a pretty large subset of intelligent Americans who say, why should I believe you about vaccines when you're clearly giving out bad advice when it comes to masks?
That's spot on.